Hello, Assalamu alaikum. Welcome back to my channel. This is Dr. Sana. Let's start today's topic. Today we are going to discuss about the contraception. Contraception means preventing pregnancy. There are several safe, effective options, and best one depends on your health, lifestyle, and plans for future pregnancy. I'm going to discuss about the main types of contraception. First method is hormonal contraception. In hormonal contraceptions, what happens is use hormones to prevent ovulation or block the sperms. So there are different types of hormonal contraceptive methods. One is birth control pills. It should be taken daily in a specific way. Okay, the strip of the birth control pills has the instructions which day which pill you should take. Okay, the next option is patches, hormonal patches on the body. It should be used weekly. Then the next option is vaginal rings. It is monthly usage. The other method is injection like Depo-Provera. It should be done in every 3 months. Next option is implants. Nexplanon. It usually lasts 3 to 5 years. The another option is hormonal IUDs. Usually last 3 to 8 years. The effectiveness of this contraceptive methods are these contraceptive methods are very effective when used correctly. Possible side effects of these contraceptive methods are that the hormonal contraceptive methods are nausea, spotting, mood changes. These all varies from person to person. Next method, that is second method for contraception, is barrier method. It means blocking the sperm from reaching to the egg for fertilization. What does it mean by barrier method? Is blocking the sperm from reaching the egg for fertilization. Types of barrier method contraception are male condoms, female condoms, and diaphragm. In other words, cervical cap. The advantage of these methods are they protect from STDs or sexually transmitted infections. The main disadvantage of this method is you must use every time. The third method is intrauterine devices or IUDs. Intrauterine methods are small devices that placed in the uterus. How these IUDs work as a contraception is they prevent implantation of the fertilized sperm and egg. That means they prevent the growth of the fertilized ovum inside the uterus. Okay, there are two types of IUDs we usually use. Copper IUDs, it is non-hormonal, last up to 10 years. The other one is hormonal IUDs. We talked about this hormonal IUDs in previous hormonal method of contraception. Okay, its advantages are almost among all the contraceptives. It is the most effective one and the low maintenance one. The next method is natural methods. What does it mean by natural method? Is track your fertility and avoid sex during fertile days. For this you must have fertility awareness. You should have a regular menstruation period. This method doesn't work in irregular menstrual cycle. Okay, in which we can't track the ovulation days clearly. So, another natural method is withdrawal method. The man can withdraw before ejaculation. Okay. In this method, the man withdraws himself before ejaculation. Okay. The main disadvantages of this method are in withdrawal method also it's less reliable if not done carefully. We can talk about this natural methods in detail in the next video. The another option for contraception is emergency contraceptive pills or emergency contraception. It used after unprotected sex. There are two types of pills in emergency contraception, Plan B and Ella. Plan B should be used within 72 hours, and Ella can be used in 5 days. So don't confuse it with the abortion pill. It is not the abortion pill. Both Plan B and Ella are emergency contraceptive pills to prevent pregnancy after unprotected sex, but they differ in active ingredients, availability, and time window. Okay, in Plan B, the active ingredient or the content of the Plan B pill is progesterone hormone. In US, you can purchase it in over the counter, no prescription needed. A time frame is most effective within 3 days after the 3 days of the sex or after the sex. So now we can talk about Ella. Ella is a pill which has the active ingredient or the action of the Ella acts as progesterone modulator. Different action, but I can describe it as, for you to understand, I can describe it as like Ella is more stronger. For a normal person to understand, I can describe it as for Ella, it is more stronger than than the Plan B. Okay, but it is not like that. The working of the Ella and Plan B are both in different ways. Okay, so we can talk about Ella is a prescription drug. You have to in US a doctor should prescribe Ella, and then only you will get the drug from the pharmacy or so the time frame effectiveness is up to 5 days. The time frame the Ella for Ella effectiveness is up to 5 days. That is mean by 120 hours. Okay, after the sex. As I said before, it is often more effective than Plan B. A point you should note that you cannot Plan B and Ella are both emergency contraceptive pills daily. You can't take it daily. It is not for daily use. It's just for if you it's just for once or twice. Okay, for Plan B, you can in a cycle or in a month, you can only use it's like a twice in a month, maximum twice in a month. Plan B, you can only use maximum 2 in a month. You cannot use it as a daily method for contraception. Okay, we can talk about how much is each contraceptive methods effective. For IUDs and implants, it is more than 99% effective. Pills, patch, rings, etc. are almost 91% effective, and condoms are 85% effective. Natural methods, the effectiveness is 75% to 88%. So, how to choose? When you have options for contraception, all these options for contraception, how to choose which is more effective or which is good for you, you should consider what you want, how much time you want, like short term or long term contraception you want. It depends upon many factors. What you should choose or what is a better option for you is determined by your needs, like do you want the short term or long term contraception. Can you remember if you can remember daily pills, then that's the best option. Do you want hormone free or hormonal hormonal method of contraception. If you want the STI protection, then all these factors should consider when you choose what method of contraception you want. Now let's talk about what Islam says about contraception. Okay. Is contraception allowed in Islam? Yes, many scholars say it is allowed, it is permissible in Islam to do contraception. The condition is both husband and wife should agree. It should not cause any harm to the people, okay, to the people involved. During the time of Prophet Sallallahu Alaihi Wasallam, some companions practiced the withdrawal method, like we mentioned in natural contraceptive methods. Some of the companions practice withdrawal methods to avoid pregnancy. The Prophet did not forbid these methods. It mentioned in books like Sahih Bukhari and Muslim. Scholars use this as evidence that temporary contraception is allowed. Let's discuss about more in detail about the natural contraception in next video. So let's stop this topic here. Thanks for watching. Assalamu alaikum wa rahmatullahi wa barakatuh.